Our Health, Wellness, and Illness project is on substance abuse. Substance abuse is the harmful use of psychoactive substances, which include alcohol and illicit drugs. This leads to negative behavior and negative health outcomes. Healthy People 2020 states that there is now a deeper understanding of substance abuse as a disorder that develops in adolescence and in some individuals will develop into chronic illness, which will require lifelong monitoring and care. Adolescent abuse of prescription drugs has continued to rise over the last 5 years for two reasons. The first reason is the drugs are more available to them, and the second reason is that adolescents believe that prescription drugs are safer than street drugs. Other problems related to substance abuse are teen pregnancy, HIV, AIDS, and other STDs. Domestic violence, child abuse, and physical fights also result from substance abuse because people tend to be more violent whenever they consume an unsafe amount of alcohol or drugs. Motor vehicle accident crashes also happens. We see a lot of this on the news with people driving under the influence. Crime, homicide, and suicide are also problems related to substance abuse. The goal for Healthy People 2020 is to reduce substance abuse to protect the health, safety, and quality of life for all, especially children.
Why do people take drugs? People take drugs to fit in with other people, to escape their own problems or relax, to relieve boredom, to seem grown up, curiosity, rejection, anger, or stress. The effects of drug abuse on health. It can weaken your immune system. It increases the risk of illnesses and infections. You can have heart conditions like abnormal heart rates to heart attacks. Nausea and abdominal pain. This can lead to changes in your appetite and weight loss. Increased strain on the liver. It puts the person on risk of liver damage or liver failure. You can also get seizures, strokes, lung disease, or problems with memory, attention, and decision-making. This can make your daily living more difficult. The short-term and long-term for alcohol abuse. Short-term, you can have dizziness, lack of judgment, lack of coordination, memory loss, and accidental injury to yourself or others. For long-term, it can affect your concentration, increase your blood pressure, which can lead to a heart attack, and you can have a risk for stomach and bowel cancer, as well as stomach ulcers.
Statistics on specific population dynamics, demographics, and addiction. A survey by the National Association of Alcoholism and Drug Abuse Counselors in 2017 American population. This was founded that adolescents ages 12 to 17 experience about 4% of substance abuse. This equals to 992,000 teens, or 1 in 25 teens. This is very important at this age when they're growing up, that we try to stop them from being influenced by drugs. Whereas parents, there's a huge contributor to the children because they follow their footsteps. Young adults, ages 18 to 25. We have 5.1 million young adults battled substance abuse, which equates to 14.8 of this population and about 1 in 7 people. I remember my school, back in high school, we would use red armbands as a Red Ribbon Week and to promote awareness of drugs and how bad they are to the body. Over the age of 26, these are average adults, that are approximately 13.6 million adults struggled with substance abuse, 10.6 million adults struggled with alcohol abuse, and 4.3 million suffered with illicit drug abuse. And for them, we want them to get into counseling, talk to people. There's a lot of providers out there that will help people who are trying to fight addiction. For our elders, it was founded that 1 million elders age 65 or older suffer from substance abuse. In the same year, about 978,000 of these people had alcohol abuse, and 93,000 had illicit drug abuse. For them, it's really important to try to get them aware of their symptoms and side effects of the drugs they're taking. And if they forget about it, just remind them why they're taking it, what's it for, and any conditions that might need immediate attention.
Okay, the nurse's role. The nurse's role regarding substance abuse is to do their research on the topic to provide effective interventions through evidence-based practice. In addition, they have to have the skills to qualify them to provide those interventions to individuals. Healthy People 2020 states, improved evaluation of community-level prevention has enhanced researchers' understanding of environmental and social factors that contribute to the initiation and abuse of alcohol and illicit drugs, leading to a more sophisticated understanding of how to implement evidence-based strategies in specific social and cultural settings. Improvements have focused on the development of better clinical interventions through research and increasing the skills and qualifications of treatment providers. So evidence-based practice is using factual evidence from research, assessments, clinical experience, and patients' cultural values and beliefs, and it is how nurses pick the correct intervention for a patient. It is important we do our research on the patient's cultural values so we can approach them with an effective and non-offensive intervention for their substance abuse. So, interventions and objectives. Interventions to combat substance abuse, as recommended by Healthy People 2020, include reducing the past year non-medical use of prescription drugs, reducing steroid use among adolescents, reducing the proportion of persons engaging in binge drinking of alcoholic beverages, increase the proportion of persons who need alcohol and/or illicit drug treatment, and received specialty treatment for abuse or dependence in the past year. Interventions that I personally believe nurses can implement are being able to identify when a patient has a substance abuse problem, provide therapeutic communication, provide encouragement to address the issue, and provide teaching and written materials to the interested patient on what substance abuse does to you and how to end substance abuse. So providing these therapeutic communications, this is one of the nurse's biggest roles. It makes the patient feel more comfortable and build trust with you. So if our patient feels comfortable and trusted in you, they can open up, they can feel comfortable to open up about their substance abuse problems, and we can implement these interventions to help them.
There is help. The Substance Abuse and Mental Health Service Administration collects information of thousands of state licensed providers who specialize in treating substance abuse, addiction, and mental illness by using your area code. For instance, ours is 813-33598. One can locate help miles away. They can use that by finding the website called Find Treatment, and there you will get treatment options, understanding of your addiction, understanding of mental health, and again, paying for your treatment.
I understand tests can cause a lot of stress, and you feel like you need to stay up at night to study. But non-medical use of prescription-only medications is a serious concern and carries many risks. Medications such as Adderall, Ritalin, Vyvanse, and Concerta are prescription stimulants and are specifically indicated for the treatment of attention deficit disorder. These medications are considered controlled substances by the DEA because they can be addictive, cause serious physical and psychological effects, and are easily abused. You're breaking a federal law if you buy or sell these medications, and could even end up in prison because of it. Serious health risks can include dangerously high body temperature, irregular heartbeat, seizures, psychosis, and even death. Mixing these medications with alcohol may elevate these risks. Please don't put your life or your future at risk. Think twice before taking someone else's medication. And thank you for not sharing your prescription with others.
This concludes our presentation on substance abuse, and we hope you enjoyed.
Thank you.
Bye.